Hey you guys, Ryan here again from Shoe Solutions. I am one of the resident pedorthists here, and today I want to talk to you a little bit about a topic that we all know far too well. That topic is foot pain. And so today I want to address, maybe we won't get too into specific pathologies like plantar fasciitis or post-tibial stress syndrome or bunions and things like that a lot of us know all too well. But instead I want to try to challenge us to look at pain as maybe a problem that can be solved, not just a symptom or a description. So what I want to do is educate you just a little bit about the way that the body functions. So at a very basic level, we have a rigid structure that is held together by working mechanism like your musculature, and then the connective tissue to the bone, which would be your tendon, and then all these interlocking tissues called ligaments that hold that structure all together. There's a whole bunch of other stuff that certainly are beyond the scope of my practice that I'm not going to get into today, but I want to talk about those main things that are specific things that I would consider when I'm helping to identify problems in your system. And so we would choose to look at things as being either a fixed condition or a functional condition. And the way that I differentiate those is that problem just what it is and we have to try to accommodate it? Or is that problem something that we can kind of correct and actually do something about or provide intervention for? See, the way that I'd kind of break it down is like, say, a functional deformity. Like say a bunion, that's something, maybe I will get into some of this stuff. But if you have a bunion, that is a structural deformity of the hallux and you're at the first metatarsal phalangeal joint. And when you have a condition like hallux valgus and that joint has really deviated from a straight line position, you get a real protrusion at that joint. Now, there's not a whole lot that we can do conservatively to fix that problem. To actually correct that, you would need surgical intervention, which, as many of you know, can be a bit of a challenge, and basically you want to exhaust conservative methods first. If they don't work, then you want to move on to things like surgical intervention for a condition like that. But when we have that bunion, I'm not necessarily going to try to design something to try to bend and twist that foot back into place. What I'm going to try to do instead is accommodate the lack of range of motion in that joint, lack of sagittal movement, this plantar flexion and dorsiflexion. And then we also need to accommodate the structure of it, so the size of it. And then lastly, we want to try to increase function in that joint. So we would look at different conservative modalities to try to gain mechanical leverage where that mechanical lever has deviated and we no longer have kind of a neutral lever. We would want to accommodate lost sagittal function in that joint, so kind of up and down movement there. And then we'd want to, like with a shoe or whatever, accommodate the size of that joint. And so that would be a condition where we'd be looking to accommodate and maybe help to provide some leverage for as well. Versus, say, a soft tissue injury like plantar fasciitis that was maybe a result of a tight gastrocsoleus complex. So that's a musculature on the back of your leg. Say you were really tight back there and that tension in the back of the leg was pulling up on your heel, and then that was stretching out your plantar fascia. And say you were going through pregnancy and your body had gained a bunch of weight, ladies, and all of a sudden that weight is flattening out that medial arch and your foot's overpronating, and you got a bunch of different soft tissue and biomechanical things that have altered in your body. And we just need to now try to correct for that and put the foot in a bit of a different, more advantageous position for your situation and your structure. Whereas you take an issue like pregnancy, that might be a short-term thing that could have long-term implications on the mechanics of your foot, sure. But if you provide early intervention, you can usually accommodate those forces and do minimal damage throughout that 9-month period of time. So that would be an example of a functional injury or something that we would consider. So you have kind of two extremes there, something that you can accommodate and something that you can totally correct or reposition or functionally correct. So that's one way that we would want to try to differentiate what might be causing that pain. Now, I'll introduce a third method here. Maybe that is injury. So say you're at work and you fall off a ladder and you break your heel. If I had a dime for every time I've seen something like that. Well, that example specifically is a major injury, like one of the worst bones in your body to break. Probably you likely will have had surgery within a 24-hour period of time, but then you have a long time of recovery and your body has to adapt to kind of the new you. And sometimes in those cases, depending on the injury, you might end up with arthrodesis or fusion of some type between that heel and ankle, where you've not only injured yourself, but you've probably lost some function there too. So as a pedorthist, we want to get in there and actually we need that medical history. So we want to know what the injury was, what has been corrected and been accommodated for from a surgical or medicinal perspective. And then we can start developing a plan that's going to lead to long-term success. In essence, we're working with what we have in order to prevent further harm in the future, or to just give you quality of life. Like sometimes, maybe you sit at a desk all day and it's not that important, but turns out you love to go hiking on weekends, or your goal ever since, you were a little kid, you wanted to run a marathon or be a triathlete or something. How are we going to get you from here to there when your body's in a lot of discomfort throughout that period of time? And as many of us know, when our bodies hurt, and especially our feet, we kind of hurt all over. And, there are other symptoms that tend to result from that, weight gain, and just because you're not as active as you'd like to be. And food is an amazing thing. And these things can kind of start to creep into our lives over time. So the sooner that we get on it, we tend to be better off in the long term. So when we identify pain, we want to kind of categorize it maybe into one of those categories. Was it an injury? Is it a fixed or is it a functional condition? And then we want to try to figure out what the best course of action is going to be to treat that. Now, the internet's an amazing place, and we can go on and Dr. Google can tell us a whole lot about plantar fasciitis, and we can look at that and say, oh, yeah, that's what I have. I have plantar fasciitis. And then we try to come up with our own solutions for that. Or in some cases, like if you Google plantar fasciitis, there are a lot of actually really good treatment methods, and you'd look at your footwear, maybe an indoor shoe, stretching, and the whole golf ball massaging thing. And those are all really good treatments. But unless you actually identify what caused the plantar fasciitis in the first place, it can be really difficult to manage that condition long term. And the plantar fascia is a really vulnerable mechanism because anytime you're on your feet, you're stressing that tissue. It has very poor blood supply, and so often coming up with a long-term solution can be really challenging. So I don't want to, once again, I keep saying I don't want to get too into specific injuries or treatment methods, but I want to talk, I just want to leave you guys with the thought process that when there's an injury, there's a problem. The sooner that we act on that problem, the better, and often correlates to less intervention. Like maybe a soft tissue injury just means some stretching, maybe wearing a recovery indoor shoe or like one of those Hoka slides or something in combination with a good everyday shoe at maybe minimal. And then at maximum, maybe you need orthotic, like custom foot orthotic treatment, as well as a good shoe, as well as a stretching plan, as well as a compression sock, as well as some massage, or, there's 500 different treatment modalities that we might use to try to recommend recovering from a condition like that. But let's just get our minds around the idea that pain is a problem. Our bodies are sending us a signal that we need not get used to. And when it comes to lower extremity function, that foundation impacts everything that sits on top of it. So, the old heel bone's connected to the ankle bones, and it just goes on and it goes up and up. So what we do in the foundation impacts the entire chain. It's not out of the question to align the foot properly and gain mechanical advantage in the knee or in the back. And what does that do? That stabilizes the trunk and the shoulder and the neck. Now, it's hard to predict results with anything, I think it's fair to say. But at the same time, the sooner you get on it, the better. And when you deal with things from the foundation up, you tend to have an entire system tends to benefit from that. So when we look at pain, let's look at it from an objective perspective. Let's categorize what the pain is, what's the cause, And then let's figure out the right treatment based on your activities and your goals. So, Dr. Google's one thing, probably not the right answer for most people and most injuries that we see coming in a day. And actually, we get a lot of people that'll come in terrified because they read something that totally wasn't the condition that they have. Talk to somebody who knows what they're doing. Book an appointment, even at a foundational level. Book an appointment with one of our fit techs. They'll scan your feet, come into Shoe Solutions, hop on shoesolutions.ca, book that assessment with one of our fit techs. And then beyond that, they can recommend maybe pedorthic intervention as well. If you need orthotic devices or if you need more advanced modalities for dealing with different types of specific symptoms, we can help with that. Now, as pedorthists, we don't diagnose things. So if you need a diagnosis for a specific condition, that's often something we would refer you to a doctor, because that's who needs to be diagnosing any problems with your body. That's not something that's in our wheelhouse. But what we can do is provide you with an assessment and with logical treatments based on the symptoms and our investigation of that. We can also communicate with any of your other healthcare providers to try to come to a solution that makes sense for you, which often involves diagnosis from a medical physician. And so we're part of that team approach. But in a lot of cases, we're the first line of defense. We're easy to get a hold of, and we're super accessible. Hop on shoesolutions.ca, book an appointment with me or one of our other pedorthists there. Even hop in with a fit tech. They know a ton about the way the body's meant to work from a conservative perspective. So thank you so much, you guys. Look forward to talking to you again. See ya.